Hello, I am Dr. Belcher. I am back with another masterclass on psychoeducation. I thought I would briefly share how psychoeducation is used in therapy. I had someone ask me if I provided information or I worked with individuals who experience schizophrenia. And so I mentioned in my video when I had the opportunity of working with Sean, who does food reviews about psychoeducation. And in that video, I just briefly touched on psychoeducation. I didn't get into a lot of detail with it. And so I had a few folks wondering what it is. And so I thought I would give just a brief education and teaching on it. And so psychoeducation is evidence-based intervention. It involves providing individuals and their families with information and support about mental health conditions. Um, It involves learning about and understanding mental health and well-being. It is a good way to think about it is like physical education, where you are learning about your body, how your body works, how to look at it, how to look after it, and then the impacts of different strains or stressors. But instead of looking at it um, how from the body standpoint, instead you apply this to the mind. And so when does psychoeducation become important in psychology? Well, early psychotherapies did not emphasize client education, and they didn't do so because they did not believe that they didn't consider it important to educate the patient on their diagnoses. And that was because they believed that the therapist was the expert and not the client. And so that view has become dated. As a therapist, I believe that the client is the um, expert in their lives. And so physicians began using psychoeducation to help their clients understand their treatment and back in the 1900s. And so in mental health, there was this researcher, C.M. Anderson, and he was the first person to um, introduce using psychoeducation with clients diagnosed with schizophrenia. And so research looked at the impact of providing education to family members to improve treatment outcomes. And so, depending on the type of treatment and specific goals, psychoeducation can take in different forms. It can also mean teaching clients specific coping skills. And coping skills are those tactics that we use to deal with stressful situations. So, is psychoeducation effective? Well, it is an important component of treatment. It has been found to improve treatment outcomes to a wide variety of diagnoses. And although research is still emerging, psychoeducation has been linked to improve treatment compliance and outcomes for stress, depression, and anxiety. And so it has been found to improve social skills and behavior management, especially for individuals who have been diagnosed with ADHD. How does psychoeducation help the client? Well, it's in addition to symptom treatment, psychoeducation has an intervention has as an intervention been shown to improve treatment protocols. Clients are more likely to follow through with recommendations if they understand what the recommendations are, but more specifically why those recommendations are being asked of them. And then it gives the client the opportunity to ask questions. It also gives that provider the opportunity to help alleviate any fears that the patient or client may have. Not only is psychoeducation an effective treatment, um, but research suggests that it is comparable to other evidence-based interventions. And so, as a therapist, I use psychoeducation with my clients individually, in group as well. I am not telling my clients what they must do or even what they ought to do. Instead, I'm providing that education, that teaching, in giving the clients accurate information about their diagnoses and their treatment options. It's up to the client to use that information to best make their own decisions of how they want to move forward or engage in their healthcare. So psychoeducation really empowers you to make your own decisions, again, on how you will move forward in your care. Again, here's my contact information. I thought I would just come on and briefly kind of explain psychoeducation. I know I had a few questions about that based off of a video that I had presented earlier in the week. And so here again, here's my contact information. I am accepting new clients, and I am definitely open to talking more with individuals who have an interest in understanding their mental health. And so please reach out. Thank you.